Mine is first to thank the organizers to bring for us a dietitian at last. This follows up the talk in Cork when we asked for one. And I just want to highlight something which is missing to make the organization much better. We are missing somebody who is in charge of pharmacy in Ireland from the HSC. He or she should attend the meeting in the following year so he can see how enthusiastic the members are to survive, so they don't see that they don't get the value for money. The other person who also should be here is somebody who is heading or the chairperson for the GP in all Ireland, so that they understand what is being said here. Then this can make the consultants work easy in that this can be fed into the various GP in the whole country. So those ones are my three observations. So I hope they will be taken seriously.
I'd say those are good observations, and I think as a group you have the power to encourage those kind of people to come to this meeting. And it's actually, I mean, I've always found it very interesting to be at this meeting because it's a completely different perspective that I get every year when I come to this meeting compared to my usual day-to-day activities. And I think it's very good for people who are running our pharmacy services to get your perspective. And I think you do have a lot of influence, actually. So I think you can, encourage is the right word, I'm sure, to you can invite people to come to the meeting.
So I think, Charles, as everybody's saying, it's a very good point. And we as a group will look to see what we can do. We're always looking to see what we can improve. And like we did ask some people from the Bloods in Vincent's to come, but they weren't able to make it today. But again, we are looking and we'll see what we can do in terms of pharmacy and GP.
About guests for next year, I'm not going to be setting the agenda at all, but if you do need a pharmacist involved, we work very closely with the primary care reimbursement system. They manage a high-tech drug scheme, and I know most of the pharmacists in that, and if you need a name, an invitation, I'm sure that can be arranged.
I just add to that, that's really, really important, and Charles and Justin has covered this. It's important. I think, fortunately, in this country, in terms of medications, we're really lucky to have, we have great exposure to most of the drugs. We don't always have to wait for it to be, covered as well. So, I mean, it should be done in the right way, but of course this is coming through the multidisciplinary group in here or Cork or in Galway, for example, that we usually get access to it. So access is not a problem, but awareness is important. So I'd like to just sort of speak positively on behalf of the pharma sort of group. In fact, they've been very good. And the high tech, if you compare it to some countries where access is difficult, we write out a special prescription for your somatostatin analogues, for example, the lanreotide or somatostatin analogues, whatever you're on, octreotide, and you go. The vast majority of times, this goes without any problems. It's for 6 months. I mean, I think it's reasonable. It's very expensive, the medication, and we're talking to some of our patients and individuals earlier on. When you need to be on it, you need to be on it, and it's not a problem. And it's done. And it's done either by your GP, some of it's done through either an Ipsen service or a Novartis service for training, just to remind people that you can self-inject, or you can get your partner to inject, or a member of the family to inject, if you want to. But my experience is that, the district health nurse will come and give it as well. That through the GP service, I think it does work. But bringing the GP or GP representative with a pharmacy representative would be a really welcome addition as well.